are a lot of courses, particularly for conservative dentistry.
Okay.
So can this be worked out as a substitute for an MDS in conservative dentistry?
Like I said, what is the aim? What is the aim? That's the thing. Now, if you want to be a clinician, right? There's no substitute. There's no substitute for anything. It all depends upon what you want to do. Like, for example, I had an aim of becoming an MDS. I had an aim to have my own setup, but I also had an aim that in the future, I want to be able to teach someone. So I need to have a specialty in which I can teach somebody, right? So if that is the aim,
Right.
you want to be your own self, you want to be known for something that you do in specific, then yes, MTS is not a substitute. Talking about clinical practice, yes, you can substitute MDS with good courses which run on a very long run, right?
Okay.
Now, some people think that you can do a 3-day course and a 4-day course of endodontics, and you can compare yourself to somebody who is an MDS, right? It does not work that way. I also conduct a 3-day masterclass in endodontics where I train people. But what is my aim? My aim is that if you are a general practitioner and you have a clinical setup, you should be in the capacity to treat an emergency case and relieve the patient of pain, or you should be in the capacity to do simple endodontic cases. But if you talk about treating calcified cases or sclerotic cases or severely curved canals or complex cases or cases where you require probably a surgery, a periapical surgery, or a patient who has medically compromised in nature, now those are somebody that you should be able to understand wherein that, okay, now this is a complex case. I have my diagnosis. Let me call the endodontist. Now, even this much of knowledge will require some amount of courses. So that is
Right.
what a 3-day course will do. But if you want to start a full-blown clinical endodontic practice, you have to make sure that you're doing or learning a course which runs for about 7 to 8 months,
Hmm.
comparable to an MDS, right? Now, what do
Right.
you do in an MDS? Your MDS, you are doing clinical work every single day. You're doing 4 to 5 cases every single day for 3 years.
Right.
Plus, you're doing research, wherein you are getting in-depth knowledge about what you are doing actually, right?
Hmm.
And then you also do theses and you do other things, you do presentations, you're making a name for yourself, right? So if that is the aim, then MGS is required. But if the aim is only clinical practice, because I know some BDS clinicians who are doing wonders, doing work better than an MDS person. So it's all about the skills. So if you want to be only a clinician, then yes, a lot of good courses will help you do it. But if your aim is to not teach, you want to be somewhere in your academics, you want to do a lot of research, if you want to do a lot of speeches in the conferences, if that's what you want to do in the future, then MDS is not a substitute.